There you go.
Okay. So, Dr. Clearfield, we're going to talk about your seminar, your conference that you already mentioned at the end of my talk. So,
okay.
Yeah, okay. Yes. Let me just. Everybody sees my slide. So, everybody can see my slide.
Yes, we see it.
Oh, okay. Okay. So when everybody goes quiet, I think nobody's listening. So I'm Dr. Parvin Zarrin, the founder of Integrative Medicine and Nutrition in Toronto, Canada. I've been practicing for over 20 years. I'm the founder of Homeopathy Nutrition Clinic. It's another name for my practice, and the founder of Bioquantum Academy. My website is www.bioquantum.ca if you'd like to visit my website and get more information about how my work, my approach, and a lot of testimonials there. And my email is info@bioquantum.ca. Thank you so much, Dr. Clearfield, for your invitation to be with you today and share my view on hyperthyroidism and hypothyroidism. I think Dr. Clearfield, to a point, knows my view about diseases and symptoms and manifestation of disease. But most of you know how homeopathy or what's the approach of homeopaths is in regards to especially chronic diseases. So I will share my insight and my view with you on this topic today. Let me just see if, I don't know why it's not moving. Yes. Okay, let me just minimize this here. As I always say, a human body has only one disease, but with many manifestations of disease, thousands of manifestations, only one disease. And these manifestations are called symptoms. Hyperthyroidism and hypothyroidism is not a disease. We don't call it disease. Disease is only one. But these are the manifestation of one internal chaos and disharmony, which is called disease. In the homeopathic domain, we treat the person, not the disease and not the symptoms. Homeopathy treatment is based on the totality of symptoms of physical, emotional, mental, and life energy force in order to remove the disease. We do not mask the symptoms by suppressive medications. We understand the symptoms for the correct diagnosis. Symptoms are your survival and should never be suppressed at any time. So I would like to talk about the thyroid gland is the master of communication. So this is my view to share with you. Thyroid has many different ways of communicating. There are different communication pathways that the thyroid gland is involved. Communications between the thyroid gland and the rest of the internal organs, systems, and all the cells inside the physical body. Communication between physical, emotional, mental, and energy bodies. Communications between human to human, because the thyroid gland is located at the communication sites where the larynx is, with the vocal cord is. This is the communication site. Communication between human and your higher self or cosmos, because it's located in the ether or space, which is the human body spiritual communication site. So whenever there is a communication problem, the thyroid gland is affected. I would like to talk about the ancient philosophy of nature's elements. I think most of you are familiar with those 5 elements. According to the ancient philosophies, the composition of the universe is classified into 5 elements: earth, water, fire, air, ether, or space. Each of the 5 elements represents a state of matter in nature. Solid matter is classified as the earth element. Water is everything that is liquid. Air is everything that is a form of gas. Fire is the part of nature that transforms one state of matter into another. And the fifth element is ether or space, which is the mother of the other elements and is the base of higher human spiritual experiences. So thyroid is located in ether or space and is the mother of all other glands. Brain and thyroid both are in space. So hyperthyroidism and hypothyroidism, they are two extreme poles of one phenomenon. It's the same thing as heat and coldness. Heat and cold, they're two different degrees of temperature. Anxiety and depression, they're two different degrees of emotions. Weight loss and weight gains, they're two different degrees of weight. Diarrhea and constipation, they're two different degrees of elimination. Rapid pulse and low pulse, they're two different degrees of heart rate per minute. So, but when it comes to physical thyroid, enlargement happens in both conditions, in hyperthyroidism and hypothyroidism, because it is one disease internally and anatomically. This is a clear proof of one disease, but different manifestations. So the relationships between the human body and the 5 elements in nature that I already mentioned, all the creation is made up of the 5 elements in different proportions. The human body is also the product of these 5 elements in different proportions. 72% water, 12% earth, 6% air, 4% fire, and the rest is ether or space where the thyroid gland is located. Usually the percentage of the first 4 elements remain constant, but the percentage of ether can be enhanced because it's your spiritual communication side. Each element is responsible for different structures in the body. For example, earth forms a solid structure such as teeth, nails, bones, muscles, skin, tissues, and hair. These give a structure and strength to the body. Water element forms saliva, urine, semen, blood, and sweat. Fire element forms hunger, thirst, sleep, eyes, vision, and complexion of the skin. And the air element is responsible for all movement, including expansion, contraction, vibration, and suppression. Ether or space, where thyroid is located, is the most subtle of all elements and is present in the hollow cavities of the body in the form of radio frequencies, light radiation, and cosmic rays. So I would like to talk about the laws of nature. According to ancient science, the laws of nature demand these 5 elements to be in balance. From ancient philosophy point of view, imbalance of these 5 elements of nature is the cause of most diseases. The source of chronic diseases is the deficiency, impurity, or intoxication of these elements, or if these elements are out of balance with another element in the body. They have to be in a normal ratio. The first imbalance is imbalance of water element. This is visible as excess mucus, cold, sinusitis, swelling of glands, edema of tissues, blood thinning, or blood clotting. Imbalance of earth elements shows itself as general weakness in the body, osteoporosis, obesity, high cholesterol, weight loss, weight gain, muscular diseases. Imbalance of fire element manifests itself as fever, skin diseases like inflammations, increased coldness or heat in the body, excessive sweating, hyperacidity, a slow digestion and absorption of nutrients, toxins in the body, or diabetes. Imbalance of air elements leads to skin dryness, blood pressure problems, lung disorders, dry cough, bloating, constipation, lethargy, insomnia, muscular spasm, and depression. But imbalance of ether or space elements, which is the thyroid gland is located, is visible as thyroid disorders, throat problems, speech disorders, communications difficulties, epilepsy, madness, and air diseases. My definition of disease is a state of internal imbalance and disharmony at all physical, emotional, mental, and energy levels. It is caused by the main underlying causes of chronic cellular deficiency, cellular intoxication, and adequate cellular energy flow. Disease manifests itself on a battleground, such as an organ or tissue based on individual trait, tendency, predisposition, and other environmental factors. Therefore, we should look into it fundamentally and treat the diseased body as a whole. Causes of disease is internal. Manifestation of disease is external. The human body creates only one disease, but countless manifestations of disease, which are called symptoms, in order to respond to the body's internal chaos. Symptoms are the communications between your inner wisdom and physical body to save you at all times. Symptoms is not a disease. Disease presents itself through symptoms, and they're simply your survival. That's how the body tries to bring the internal state back from chaos to harmony. Symptoms must not be suppressed by suppressive medications at any time, because the vital communications between your inner intelligence and physical body will be silenced. Therefore, disease evolves from benign to malignant, and ultimately the body goes towards degeneration and destruction. So the thyroid is the master gland of metabolism. Now I would like to talk about the physiological aspect of it. The thyroid gland plays a major role in metabolism, growth, and development of the human body. It calibrates and regulates many bodily functions by constantly releasing a normal amount of thyroid hormones into the bloodstream. Disease presents itself on the thyroid gland by manifesting itself as hyperthyroidism or hypothyroidism. Thyroid is the battleground for the internal disease. Hyperthyroidism is not a disease, neither is hypothyroidism. They both are the manifestation of one internal chaos or disharmony. In thyroid conditions, the battleground is a thyroid gland, but the disease is originated in different pathways, including the brain, liver, kidneys, and immune system. I would explain them all later. Disease in thyroid conditions is caused by a long-term miscommunication between the hypothalamus and pituitary glands in the brain. Miscommunication between pituitary gland and thyroid gland. Miscommunication between the thyroid gland and the liver. Miscommunication between the liver and kidneys to convert thyroid hormone from inactive to active form. And miscommunication between the immune system and the thyroid gland. When the immune system wrongly attacks the thyroid cells by causing the thyroid to falsely produce either excessive amount or too little amount of thyroid hormone. So as we can hear from this, there is an internal war inside the human body. You can see the manifestation of disease. For example, hypothyroidism, you can see the overweight body. Hyperthyroidism, you can see underweight body. Another manifestation, the both manifestation of are from one internal disease. So you can see the anatomy of hypothalamus and pituitary gland. They both are they're deep inside the brain, and they have very, very strong communications. Without communication between hypothalamus and pituitary gland, thyroid gland cannot be stimulated and activated. So as we know, hypothalamus is always producing, releasing, or inhibiting hormones, and works on pituitary gland to stimulate, to produce stimulating hormones such as TSH, thyroid stimulating hormone. So now I can get into the physiology aspect of it. So communication pathway between brain and thyroid. It's the first communication pathway I would like to talk about. So as we know, hypothalamus is always have a strong communication with pituitary gland by producing TRH, thyroid releasing hormone, and stimulating pituitary gland in order to produce thyroid stimulating hormone. And TSH is going to affect thyroid and stimulate thyroid to produce T4 and thyroxine T4. So as we know, T4 is not an active form of thyroid hormone. It has to lose one iodine molecule in order to be activated. So T4 has to go through liver in order to be converted to T3. So there is a communication, very vital communication between thyroid gland and liver after the vital communication between hypothalamus, pituitary gland, and thyroid. As we know, TRH and TSH, these are two hypothalamus and pituitary gland hormone. Both hormones are similar in molecular structures. Thyroid releasing hormone TRH that signals the pituitary gland to ask the thyroid gland to produce more or less of T4 by either increasing or decreasing the release of a hormone called thyroid stimulating hormone. So TRH, or thyrotropin releasing hormone, also called thyrotropin releasing factor, is a releasing hormone produced by the hypothalamus that stimulates the release of thyrotropin stimulating hormone, or TSH, from anterior pituitary gland. So T4 has to be converted to T3 in active form, otherwise T4 cannot do the job. Thyroid makes mostly T4 in active form of thyroid hormone and a small amount of T3, which is an active form, but a small amount from thyroid cannot do the entire job, such as metabolism in the human body. T4 is naturally converted to an active form T3 in a healthy state. Most of this conversion happens in the liver. 80% of T4 that is produced by the thyroid gland is converted in the liver, and the rest is converted in the kidneys, in the cells of heart, muscles, gut, and nerves, but mostly in kidneys. Conversion of T4 to T3 is done with a special enzyme which removes one molecule of iodine. The active form of thyroid hormone has 3 iodines only, instead of 4 iodine molecules. So this very important job is done 80% in liver and the rest in kidneys and some in heart, guts, and nerves. So this is another slide that I'll talk about. It shows the thyroid liver pathways. So the first pathway was the brain and thyroid. The second is liver and thyroid. So it very simply shows the pathways between hypothalamus, pituitary, thyroid, and liver. And the T3, after it is converted in the liver, goes to the all tissues, target tissues such as heart, fat, brain, bone, muscles, and everywhere in the body. That's why the communication of between thyroid and liver is very, very vital. So it's another slide that it shows T3 is going to get to all the targeted tissues and organs in order to function. So now we're getting to the hyperthyroidism, or the manifestation of the disease. Thyroid hormones T4, let me just hold on a second. Okay. Thyroid hormone T4 is not produced without an adequate level of TRH from hypothalamus and TSH from pituitary gland. Communication between the origin of disease and battleground must get back to a natural speed and balanced state in order to remove the disease. If we cannot correct the communication between the brain, hypothalamus, and pituitary and thyroid, we cannot remove the disease and we cannot bring the body into the balanced state. When the communications between the 2 glands in the brain, hypothalamus and pituitary gland, are faster than normal, more TSH is produced by the pituitary gland, and the effect of high TSH on the thyroid causes to release more thyroid hormone. When the communication is faster than normal, too much of thyroid hormone causes fast metabolism and hyperactivity in the bodily biological functions, and consequently creates symptoms such as anxiety, nervousness, palpitations, high appetite, high temperature, increase in heart function, weight loss, diarrhea. So the internal disharmony or disease is manifested on the thyroid gland as hyperthyroidism. This condition, unfortunately, is always suppressed by the pharmaceutical and anti-anxiety and thyroid hormone replacement drugs by the mainstream medicine. By doing this, you're shutting up the natural hormonal communication pathway. You can see the details in this slide. Hyperthyroidism on my left. You see the picture of this girl that her eyes are bulging out, and you see the goiter, and the thyroid is enlarged. In hyperthyroidism and hypothyroidism, both conditions, the thyroid is enlarged. So the symptoms, as I mentioned earlier, they're mostly hyper. The body generally all over becomes hyper, such as excessive sweating, such as heat intolerance, increased bowel movements, diarrhea. It's tremor, nervousness, agitation, rapid heart rate, weight loss, fatigue, decreased concentration, and irregular and scant menstrual flow. Unfortunately, I had several. Several is very less. I can say hundreds of patients coming to me with these symptoms, with that they have been on anti-anxiety and antidepressant pills for years. So and also beside the thyroxine or synthetic thyroid hormones, and what they told them is you have to be on this medication for the rest of your life. So they put me into like a long challenge, long-term challenges in order to get them off the medications and bring them back into a state of health and balance. So hypothyroidism, it means that a whole biological function, it becomes a slow. Its hypoactivity is everywhere in the body. When the communication between the two glands, hypothalamus and pituitary glands, are slower than normal, inadequate TSH from the pituitary and the effect of low TSH on the thyroid gland causes to release less thyroid hormone. Too little of thyroid hormone causes a slow metabolism and hypoactivity in the bodily biological functions. Hypofunctioning creates symptoms such as low metabolism, fatigue, exhaustion, depression, low appetite, constipation, low cardiac output, weight gain. As we see, they're completely opposite of hyperthyroidism. Coldness in extremities. So the internal disharmony or disease manifests itself in the thyroid gland as hypothyroidism. Again, this condition is always suppressed by the pharmaceutical antidepressant and thyroid hormone replacement drugs by the mainstream medicine for life. By doing so, again, you're shutting up the natural hormonal communication pathway for life. As you can see, another slide here and shows the hypothyroidism, which is a low functioning at all levels. Is not only the physical levels, it at mental, emotional levels as well. So when we see fatigue, intolerance of cold, poor circulation, poor concentration, these are all levels. As you see, the symptoms of hypothyroidism is completely different, the opposite of hyperthyroidism, but they are one phenomena, just two extreme poles of one phenomena. So when the patients are, these symptoms of hyperactivity and hypoactivity are suppressed by long-term medications, the thyroid gradually is losing the battle. The two manifestations of hyper and hypo, they are survival in thyroid glands, because thyroid glands alternates in the beginning in order to compensate the high and low functioning and save you from further damage. If the hyperactivity stays for a long time, it can kill. That's why thyroid is trying to become hypo in order to compensate. If it stays in a hypo state, it still kills. It has to go hyper in order to keep you survive. And it should not be suppressed. It should be understood. It's very important to understand the thyroid hypo and hyper activities, which are your survival. But unfortunately, these vital symptoms are always suppressed and shut off by the consumption of the thyroid suppressive medication for a long time and sometimes for the rest of their lives. By doing so, the entire normal body communication is blocked. The thyroid gland gradually becomes inactive. It gradually loses the battle and is eventually defeated. And the person remains on the thyroid medication for the rest of her life. So I would like to talk about my approach, and I treat 4 communication pathways simultaneously. I will talk about the other 2 communications in next slides. The first communication in the brain between the hypothalamus and pituitary glands to balance the production of the 2 hormones, TRH and TSH. The very first thing I do for these patients is to correct the communications between hypothalamus and pituitary gland. Also, I would correct the communication between the pituitary and thyroid gland to balance the productions of the 2 hormones, TSH and T4. I would work on thyroid liver communication, which is it's very, very vital. And if you don't do that, there is no cure. Cure does not take place. Thyroid liver communication is very vital. Communication between the thyroid and liver needs to come to a state of balance and healthy by detoxifying the liver, drainage, and is supplementing the liver and with homeopathy and also through food and nutrition in order to make the liver clean and detoxified in order to convert T4 to 3 much faster and easier and better. And I work on thyroid immune system communication, mostly in patients with Hashimoto's disease and Graves' disease. Not necessarily in 100 patients, 100% of patients, I need to work on thyroid and immune system communications to that level, but I almost work on every single patient, but mostly in deeper in Hashimoto's disease and Graves' disease, and currently I have patients with Hashimoto's disease. Communication between the immune system and the thyroid gland to make the immune system function normally, especially in autoimmune diseases such as Hashimoto's and Graves'. As we know, inflammation that is produced by innate immunity reduces thyroxine hormone productions and causes hypothyroidism. So if in the long term, in the long time, the body goes through inflammation, I have to address innate immunity. I have to work on innate immunity in order to reduce the amount of inflammation. And also I work on the adaptive immunity if there is excessive amount of antibodies, because excess amount of antibodies increases thyroxine hormone production and causes hyperthyroidism. So at this point, patients with autoimmune diseases, I work on both innate immunity and adaptive immunity in order to bring the function of thyroid in the state of balance. So it's another slide that shows that, for example, cytokine has works on affects the production of TSH, thyroid stimulating hormone, and thyroid stimulating hormone also, it's the main hormone to stimulate thyroid gland in order to produce T4 and T3. So inflammation has to be addressed, especially in autoimmune diseases. another thyroid immune system connections that they will tell you when the neutrophils, natural killer cells, monocytes, macrophages, and the dendritic cells are increased. So thyroid gland is affected because if immune system has thyroid receptors. So this communication has to be addressed. This communication has to come in a normal and balanced state. My approach about hyperthyroidism and hypothyroidism, as I mentioned earlier, as a homeopath, we do not treat symptoms. We treat the patients with the disease, and the symptoms are going to be removed gradually. Also, the disease from within. As a homeopath, I do not treat hyperthyroidism and hypothyroidism as a disease. My approach is adaptogenic, to bring the body's biological activities into the state of balance and harmony by homeopathic medicine. And the manifestation symptoms such as hyper or hypoactivities are gradually removed according to their time of appearance. So what I always do, I think some of you might be familiar with my approach or a homeopathic approach, but I always do the constitutional case taking in order to understand the person and to bring all the bodies, physical, mental, emotional, and energy bodies into alignment, and in order to cure the patients. And without doing this, it's going to be a struggle. So there are some other homeopaths, they might not do the constitutional in addition to the other form of homeopathic medicine, but I always do. So bringing into the body into alignment and harmony is the major and one of the first step I do. I always select a constitutional homeopathic remedy according to totality of symptoms. Totality of symptoms is not hyperthyroidism or just hypothyroidism. I go, it's like 3-4 hours of case taking in order to truly understand the person from the childhood to now, as the level of physical, emotional, mental, and energy. There are many different remedies, single remedies, but the one that have been very successful in my practice have been graphites, calcaria, carbonic iodinum, lycopodium, argentum nitricum, thyroidinum, and many, many more. Because I worked on my PhD and on weight loss, those remedies, and you know that the weight gain it's related to function of thyroid gland. So these remedies work so well on my candidates, and I use them always. In addition, sometimes it's just it just comes on its own as a constitutional remedies, but sometimes I use them as a supporting remedies in addition to their constitutional remedies. And also I give a supporting single remedy such as a spongiotosol because it has iodine content to enhance the effect of constitutional remedies. So it's the very first step I do for everyone. The second step is I work on the brain pathways. As I mentioned, the communication pathways, I work on the brain pathways, removing the chaos in the brain to balance the communication between the hypothalamus and pituitary glands. TRH from hypothalamus and TSH from pituitary should be produced adequately in order to activate the thyroid gland on time. I use brain supportive homeopathic minerals that we call it tissue salts to remove the chronic brain cellular deficiencies. Brain becomes deficient so fast and needs to be fed correctly. Brain detoxification by indicated homotoxicology and homeopathic remedies. And I do brain electromagnetic function by selecting a specific oligotherapy or trace minerals. I use the second step is pathway. Okay, the brain pathway. The third step is thyroid activating remedies. These remedies supporting the thyroid by using glandular or organotherapy homeopathic preparations. When the thyroid is stimulated and activated, it naturally produces right amount of hormones. Thyroid detoxification and drainage by selected chemotherapy remedies, and thyroid mineralization by homeopathic biochemic minerals to remove chronic cellular deficiencies. Because as I always say, there is a trinity of the disease, always three major underlying causes that can cause chronic diseases. The very first one is chronic cellular deficiencies. A second one is chronic cellular intoxication. And the third one is inadequate energy flow at the cellular level. These three things has to be addressed at any chronic cases. So I work on the liver and kidneys as well. As I mentioned earlier, 80% of T4 is converted to T3 in the liver. The liver has to be cleaned. The liver has to be detoxified and has to be healthy in order to do the conversion. Fatty liver, deficient liver, intoxicated or injured liver cannot function properly to convert T4 to T3 adequately and properly. 20% of T4 is converted in the kidneys and other tissues such as heart and nerves and guts, but mostly in the kidneys, and a small amount is in the heart, guts, and muscles. But the liver and kidneys are the two major converters. So these two organs have to be cleaned and detoxified. And generally, always when I do the liver detoxification or drainage, I always work on the kidneys as well, because these two glands, they're always supporting each other and they're relying on each other. So they have a good communications as well. So when their liver is overloaded, it's very secretly asking kidneys to come to help. So, and since I understand the language of kidney and liver, so I know what to do. And in most cases, I do the kidney detoxification as well. So I give immune system supporting remedies as well. They're all homeopathic remedies, especially in autoimmune diseases such as Hashimoto's and Graves' disease. These remedies, their immune system reactivation, their immune system support, their immune system adaptogenic. They're working on the chronic inflammations. As I said, inflammation is produced by the innate immunity, chronic infections, and people that they have a history of frequent antibiotics, and and they work on broad spectrum antibacterial activities. I use a lot of homeopathic minerals or tissue salts because these tissue salts or biochemic homeopathic minerals, they are everywhere in the body for structures, for enzymatic actions, for electromagnetic, and these 12 tissue salts are kind of they're golds, you know, they're brilliant kind of minerals, and they're the best way of using minerals is these tissue salts, because they are in a nano size and mini doses, and they are absorbed through capillaries under the tongue. They avoid digestive tracts. They're directly goes to the circulation, and they are super effective. So there are some thyroid elements that we shouldn't ignore, such as iodine, selenium, zinc, and copper. But I do not give iodine in hyperthyroidism. The rest, such as selenium and zinc and copper, I give to both, but only iodine I do not give to hyperthyroidism. And also, food and nutrition is the key as well. And I always designed a diet plan for my patients. The only difference in hyperthyroidism and hypothyroidism is the cruciferous food, such as cabbages, that they have high iodine content. But honestly, they have to have a lot of, for example, cabbages in order to get this amount of iodine that can be dangerous. However, it is impossible to receive that excess amount because you must eat a lot of them. But again, to be a safe side, and I'm also a very conservative practitioner, I always tell them, especially for the next 6 months, stay away from those kind of iodine content food, and then you can start, eating them later. Also, I highly recommend them to avoid any form of inflammatory food, because you don't want to activate innate immunity to produce unnecessary inflammations, such as dairy products and wheat products, and also nightshades. Nightshades is, even in weight loss, I ask everybody to stop having nightshades, such as eggplants, cucumber, tomatoes, potatoes, and those kind of things. They are like histamine producing foods, and especially in thyroid, hyperthyroidism or hypothyroidism, I ask them to stay away from all this nightshade that can cause histamine productions. What I highly recommend is intermittent fasting to almost every thyroid patient, to take the workload off the thyroid and liver. The main thing is the liver, because when you're constantly eating, your liver is constantly working. So I ask them to, do the fasting, intermittent fasting, maximum 2 times a day with the frame of 16 hours from today to tomorrow. For example, 11 in the morning, I ask them to have something according to what I prescribe for them, and then don't eat anything until 5:30 in the evening, and then not to have anything until 11 a.m. tomorrow. This way, you can help the liver to get the load off, and you can help the liver to regenerate and renew. Intermittent fasting is always part of my nutritional recommendation, almost for everybody. So I would like to just talk about the non-physical communications, which I talk about it in the very first slide, because thyroid is located in a spiritual side. And I talked about the communication, and I would like to talk about the spiritual aspect of it too. Communication at the spiritual level is very important in thyroid health. Practice healthy, conscious, and effective communication routinely, because thyroid is located at the human communication side in the ether at the second chakra. Practice a correct spirituality, because thyroid gland it's the human spiritual center. By practicing so, you enhance your consciousness, your health, and your life possibilities, and effectively cleansing your thyroid gland and eventually your life. So I have a course of 10 hours for metabolism and chronic diseases, including the thyroid affections, at the Bioquantum Academy. If you would like to get more information, my email is info@bioquantum.ca. You can get in touch with me, and it's my pleasure to give you more information. If you have any questions, I can stop sharing, and I'm open to the questions.
Dr. Zarrin, what about, us medical doctors that are stuck having to give medications out?
It's what, sorry?
Us medical doctors are stuck having to give medications out, or we get called things like, what was I called? What was that?
Shaman.
I got called a shaman, and a disgrace to my degree by an endocrinologist. So you don't have that issue, but a lot of us here do. So any suggestions as how to get around it?
The only thing that we can work together, the only recommendation is just work with the homeopath. That's why it's my offer to whoever working with even medical doctors, because even whoever becomes a doctor, everybody wants to save lives. But unfortunately, it's just the wrong training. I'm not here to talk about this, but what I'm always offering everyone, please let's come together. That the whole purpose of all these global conferences is just to come together, because we are under oath. We are practicing under oath. We are supposed not to harm. is supposed to help, right? But
Right.
unfortunately,
Well,
with the long term, we are here to. I'm not saying to heal because we are not healers. We're just helping people to
Right.
heal themselves. But we are here to help. We help them to cure, not to put them on the chemical medication for the rest of their lives, to shutting down all the glands and all those, as I said, the communications. It
Right.
practically.
Here in Reno, it's a radical concept to tell somebody with thyroid issues to try a gluten-free diet. That was considered just outside the bounds of medicine, So, and the endocrinologist told this person who was doing really well that what you eat doesn't matter. And it took 4 weeks for them to get back into the suit. So, do you ever use any plant sterolins? Have you ever used any of those things?
In my practice, you're
Yeah.
talking about my practice?
Yeah.
No, I am strictly a homeopath.
Okay.
I work only with homeopathic medicine and nutrition because as you know, I'm
Right.
a nutritionist as well. And
Mhm.
nutrition is the base of your health for sure. I always say your health and your healing starts from your kitchen. But there are times that the patient comes to me, they're like drugged up, and nutrition alone cannot help. But no, I'm strictly a homeopath. I work only with homeopathic medicine, and it does wonder. It does miracle. It's just. But the problem is that whoever comes to me, they come when they're messed up. When they're messed up, and even I have patients that they have been on thyroid medication for 30 years, for 3 decades, and no thyroid medication is no longer working for them. And they're developing, more disease and more conditions. And it's a time that they think about somebody like me, and they come to me, and now I have to fix them. But it's my job, and sometimes it's very challenging. But since I know homeopathic medicine works amazingly, and I have faith in homeopathy, and I have faith in myself that I can make the right diagnosis, I never say no, and I just take them, and I work with them. Sometimes take 2 years, sometimes earlier, sometimes later, but I know that the cure occurs. So yeah, I'm not herbalist. I don't work with herbs, but
Okay.
the only thing that I do that it comes from plants is gemotherapy. Gemotherapy is a plant-based, but it's prepared according to homeopathic principles. That's why I incorporate it to my practice.
Okay. Perhaps you could give us a talk sometime on gemotherapy. I think a lot of us here are not
Yes.
really familiar with it at all. That was a term I heard, I think, from you and somebody else for the first time, maybe Dr. Bourne, who's a naturopath. I think he used that term.
Yes.
Also. That's not something that I'm familiar with. I don't know about anybody else.
Gemotherapy is amazing system of medicine, and everybody can work with it with any background. The beauty about gemotherapy is that works at the cellular level. The reason that I chose it, because it works at the cellular level. Diseases start at the cellular level. It's not functional. I do not work with the herbs because herbs are functional, and that's not my area. So anything that works at the cellular level, such as oligotherapy, trace minerals, gemotherapy. And the beauty about it is it's very deep acting remedies. They're full of minerals. And because they work at the cellular level, at the same time, simultaneously, they're releasing minerals into the cells, but cleansing the cells at the same time. It's like detoxifying and releasing nutrients. And it's super nutritious, and it works amazingly. If you like, I have a full course as well, or I can give you a workshop on gemotherapy. If it can help your practice, I would definitely, it's my pleasure to do it.
Well, I, for one, would be interested. Yes. So,
I know homeopathy, and you need 4 years of, I studied 10 years. So homeopathy is, but homotoxicology you can do. Homotoxicology are definitely, it's a beautiful, beautiful system of medicine. It's homeopathy, but it's call it modern homeopathy. So it's much easier. It's not constitutional. So you have to go through like a long-term training. But I teach it too. You can incorporate it to your practice, and it does amazing, amazing job combined with chemotherapy. So, definitely when you work with those things, you will not work with anything else, Dr. Clearfield. I'm telling you.
All right, I'm sold. So
yes, the first student tonight.
okay, Dr. Nario asks, do you use single homeopathic remedies approach or multiple remedies approach? So I think you already answered that.
I am classical homeopath. As I mentioned, I always prescribe single remedies for the patients. But in addition to that, I use homotoxicology as well for drainage and detoxification.
When you say, do you use the injectables at all or no?
In Canada, we can just inject like vitamins. Yeah, inject like homeopathy is injectable, yes, but it's been discontinued in Canada years ago for homeopaths. So not necessarily for homeopaths. Health Canada discontinued injectable homeopathic remedies, so suppliers do not provide it to us.
Got it. Okay. Well, I'm sure if Dr. Halas is on, he'll tell you to just call Mike Beamer. Mike can make
Halasa here?
I thought I saw him here earlier. Dr. Halasa, he'll just tell us to call Mike Beamer at Amex Pharmaceuticals, and he'll get us anything. So
Canada is very restricted. You know, it's different than United States, and the United States, even states are different. But Canada, the whole Canada is governed under Health Canada. So whatever we receive, we have to work with, you know, and we cannot ask.
Dr. Ortel asked a question, and Dr. Ortel, if you're still here, can you unmute? Because I use something, I'm an MD, I use something for symptoms, so it may have two different, and it usually works. I'm not sure what that means exactly, but so.
Well, I was just saying, in my own life, I've often done two different things, you know. So maybe I had the flu and I used a homeopathy thing for the flu, but then I had a sore knee and I used, you know, Arnica Montanica or something like that. You know, I used them at the same time and it seemed to work. And then I've had surgery, so I used something for pain, but I also had an x-ray, so I took something for the x-ray. So just saying.
Okay.
But that's personal. I'm an MD. I have no training in homeopathy. It's all self-learned.
Well, you've been with us for almost a year, so we'll let you stay. Okay?
Great.
All right, thank you.
Thank you. Thank you. So yeah, homeopathy definitely works. And the problem is that not everybody knows about homeopathy. So and thank you so much that Dr. Shirley, you tried it and you tried it and you know that it works. And imagine you're not a homeopath, but you're a believer that works. But me as a homeopath who studied 3,000 hours, this is in my DNA. So
So I mean, I'm not a homeopath either, but I use about 20 different remedies. I'm very comfortable with them. I've used them for a long time. I sort of like know my lane with them, you know your limitations. So I know what the ones that I use, I know what they're for. Sometimes, you know, the minutia that they, you know, when you go through the homeopathic, you know, diagnostic system, you know, is it wet? Is it green? Is it yellow? You know, each one is a different, takes you to a different remedy. It was, you know, seemed a little, I guess in the computer age, it's a little bit better or easier, but for me, it seemed very difficult. So,
Dr. Clearfield, you said 20 different.
About 20 different remedies that I use
You
fairly
use
regularly.
for yourself or in your practice?
In my patients. Yeah,
Okay.
we use them.
So how do you use them as a keynote remedy? Like, for example, like arnica for pain or this for that?
Yeah,
That's how you
yeah.
use them?
Yeah.
Okay, these are keynote remedies. So
Right.
sometimes might work, might not work. Keynote, it might work, might not work, but when you prescribe it as a totality of symptoms, it definitely works.
Okay. What Dr. Ballard asked, what dramatic changes does a patient notice when using a detox program?
Sorry, can you repeat your question again?
What changes can a patient notice or expect when using it when beginning a detox program? So
Okay, detox with homeopathy.
Yeah, that's what I'm assuming.
Yeah, because detoxification can be done with so many different modalities. But if it's homeopathic medicine, there is no way of knowing that how the person responds to the detoxification. So, but homeopathy is very gentle, is very safe, and very effective. It does not cause any side effect or something, because side effect is not a term for homeopathy. Side effect is a term for chemical medications, not for remedies that works at the quantum level. So, but definitely detoxification, when there's removing the toxin at the cellular level, it might cause some form of eliminations, such as, I haven't seen any kind of pathological things, but it's sometimes, people reporting to me that, for example, liver drainage.
I think part of the question would be what positive, what are the positives? What are the positive outcomes for in a detox program? Do you know what I mean?
When we know the negative aspects of toxins, what's the negative aspects of toxins? When you're removing the toxins, then the positive aspect is, it's easy to know. Detoxification at the cellular level. So homeopathy is at the cellular, is overall. So you feel changes in every single level. From mental, emotional, physical, energy, everything is balancing. You feel better at all levels. So patients reporting to me that they learn things better, they exercise better, everything at every single level feels better. So because toxins is blocking all the communication, and toxins is blocking the gate of the cells, and nutrients cannot get to the cells, and you don't get, energy. So toxins is replacing your food. You're replacing the cell's nutrients. So when you're removing the toxins from the cells, the nutrients gets in, and that's how you get, vital energy. So you feel good at all levels.
So, okay, so Joel and I should not go to Kentucky Fried Chicken after this? Is that what you're telling us?
That didn't say that. I didn't say that's
No,
toxin.
we're not. We don't do that. Dr. Nario asked, can we give thyroid medicines and do kidney, liver detox at the same time, or should the detox come first? I think the question is,
what does it mean? Thyroid medicine in homeopathic thyroid medicine? That's what he said.
I think I'm not really sure whether it is or not. Dr. Nario, if you're on, you could.
Can he come to?
If he's still on, I'm not sure if he's still here. So, the question would be: would you do a detox first before you would begin medication? If they're already on medication, how do you handle that? Is the goal would the goal be to eliminate medication? Because these people are told that it's for life, so.
Okay. Actually, I don't know if you remember all the pathways that I talked about, the communication pathways. So we have
Right.
to go a step 1, a step 2, a step 3. There were 7 steps. We
Mhm.
have to go, and that's my way of doing it. And when
Okay.
when I'm confident that it's a time to start gradually get them off the medication, I will start. It doesn't happen less than 6 weeks to 3 months, because I have to prepare the body. I have to prepare all the dimensions, all the levels in order to get them off, because those medications are habit forming and we don't want withdrawal symptoms. I don't want that. I'm very conservative, especially with people that they have been on medication for a long time. So I am very, gradually starting. And then when I am sure that it's a time to get them off, I start getting them off, not instantly or completely. I try to taper them off and gradually. Sometimes it takes a year. Sometimes, for example, I had a patient that's been on the thyroid medication for 27 years. I started, get her off after like maybe 2 months, and it took like 11 months that she completely got off the medication, and she's been off for 7 years and she never went back on any form of medication. So I have taken got off. So every whoever comes to me wants to go off. They don't want to stay on the medication that they come to me. That's the reason they come to me. So and then I always, according to the case, I would tell them some might take 2 years, 3 years, but that's the ultimate goal, that to get them off, and I get everybody off. There is no way that they go out of my office with the same medication. So, but it has steps, a step by a step. Sometimes I have to ask for like 2 weeks, 3 weeks to stop all the treatments. We just wait. And then we go back. Again, we stop. Then we go back. Things like that. We work one-on-one. And I always say it's a teamwork. You have to, it's a challenge. You're coming to me when you're completely drugged up for 2-3 decades. It's a teamwork. And then, as soon as I see there is withdrawal symptoms, I say just stop. Then after 2-3 weeks, we go on again. So this is an art, You have to be an artist to be a homeopath.
I know. So, I give a lot of lectures to a lot of groups on thyroid issues, and now I feel like I don't know anything. So Dr. Southard, just a comment: 2 Brazil nuts a day gives an adequate amount of selenium. So that I've heard that also.
Yeah, that is high in selenium, definitely. So, but when it comes to the suppressed patients, everything is suppressed, even digestion. So at this point, I would prefer to give them oligo element like trace minerals in a very, very minute dose than food. But when I am sure that the food can replace that, definitely they can switch over that.
Okay. Question from Mary Ellen Southard: are you familiar with source resonances? I'm not.
What is it?
It's called source, SOURCE, new word, RESONANCES.
URES? Source?
So it's out of the work of Peter Chappell, who was a very well-known homeopath out of the UK, and it's basically a new form of using homeopathy, using sound waves. And so I just completed a course in the UK using source resonances, and it's been fascinating. So I was just wondering if you were familiar with his work. He actually worked in Africa in the 80s, and didn't really know how to help patients that were dying of HIV/AIDS, and came up with this, unique way to deliver homeopathy to patients that really needed help, and saw dramatic results. And so if you get a chance, anybody, you can check out, I left the link for the website because I think
Awesome.
it's pretty fascinating.
I haven't worked in that area. I don't know, but definitely when you have seen great results, please just
Yeah.
advocate it.
Yeah, it's not just for AIDS patients. Right, but that's where he sort of began his journey with it.
Yes, I had AIDS patients, but I cured them with my my approach. So homeopathy works in doesn't matter. But yeah, definitely some people are very creative. Some homeopaths are very creative, and they try to create something new, which a lot of homeopaths don't know about it. And yeah, but that's great that it works.
Okay. Okay, we have from Dr. Carmen Scott Dawson, who's got an awesome picture up there in the upper left-hand corner of mine. First of all, Joe B introduced us to the group. Welcome. You left your email there. Is it okay if we put you on our mailing list?
Absolutely, absolutely. So, coincidentally, I am making a pot of cabbage and potato soup right now. And my grandfather gave me this recipe when I was a little boy, and he called it peasant food. And the fact is Ebony is fasting now. And so you mentioned cabbage, very fast was a good thing. And then you said potatoes. I think you referred to them as fat, or you mentioned potatoes and a couple other vegetables as being not so good. So I just wanted to ask you to talk me through that, namely because I thought I was doing a great job making her the soup.
Okay, no, I said only in hyperthyroidism, people that they have hyperthyroid, I ask them to stay away from cabbages and cabbage family because of high iodine content. And it's not forever, it's just temporary, but to just be on the safe side. And also because I try to control the innate immunity inflammation, because immune system has receptors of thyroid. I ask them to stay away from inflammatory food, such as dairy products, such as wheat products, and nightshades. Nightshades are producing histamines in some cases, such as cucumber, tomatoes, eggplants, potatoes, such as cherry, like black cherry, red cherry. These are nightshades and producing histamine. And when histamine increases in the body, innate immunity is creating inflammation. And inflammation is affecting the thyroid. So these are like a chain. So if you don't have any conditions such as hyperthyroidism or hypothyroidism, you don't have to stay away from them. But if you have allergy,
That was in Southlake, right?
yeah, if you have, for example, allergy, I would ask you to stay away from all these foods, especially tomatoes, eggplant, cucumber. So, but if you don't have allergy and you don't have any thyroid conditions, there is no reason. So I don't know if I answered your question.
You answered it absolutely wonderful. Thank you so much.
much.
And thank you for reading my question. I appreciate your time. Great presentation.
And I know you're going to send some of that soup out for the rest of us, right?
Without a doubt.
Okay. Dr. Rodriguez, just a comment. I use homeopathy on my pets. Dr. Burgess is asking, favorite homeopathic software program from anybody? Do you have any recommendations for us, dullards in the MDDO world to push us along? I've used Boron's website.
I had 2 radars. I had 2 top, radars, but I never worked with them, The reason is, I don't want to say that I am materia medica, but I love to be a materia medica myself. And that's why I never rely on the devices and, those kind of radars. But it's very good for non-homeopaths, people that they're not, practitioners that they're not homeopaths. It's very, very helping. But for me, who loves homeopathy, and I am practically in 5 minutes, the patient talks. I know the remedy. At this point, I think radar is not needed in my practice. It's just waste of time for me, because and also I love to go to my Materia Medica as a reference than using radars. But I think Dr. Kim, I don't know if you know him, he's United States. He's a supplier of one of the best radars in North America. So I had two, but I gave them away, and I cannot recommend you anything else.
Right. Dr. Southern mentions that Roger Morrison's desktop guide is a great Materia Medica reference.
Rogers Morrison, yeah.
Yeah.
Rogers Morrison is Dr. Rogers Morrison. He's medical doctor who switched over to homeopathy. I have all his books. He's brilliant homeopath. The good things about Rogers Morrison is the desktop that he has is the best for MDs, for medical doctors, or people that they're non-homeopaths, I'm saying, the non-homeopath. For me, as a homeopath, I would like to go to my Morphe, like I'd love to go to my original Materia Medica, but Rogers Morrison helping so many practitioners that they're around homeopathy, but they want to use homeopathy in their practice. And I highly recommend the desktop of Dr. Rogers Morrison for all practitioners that they are not homeopaths. So it's super brilliant, books. So yeah, I definitely recommend them.
Okay. Mary Ellen again says Boron has a year-long Center for Education and Development of Homeopathy for Professional Licenses course. So there we go. Boron, yeah.
Boron, Canada?
I don't know if it's Canada. So
Right.
Yeah.
Boron, so.
Boron is a supplier.
Yeah, I know.
Okay. So Boron was a pharmaceutical originally.
Right.
It's in the Quebec province of Canada, and that years ago they bought Dolisos when it was a homeopathic company in France. They bought them over. So Boron.
This is their educational arm. Their educational arm is called CEDH, the Center for Education and Development of Homeopathy. And so they have webinars, and they have a year-long course for licensed practitioners.
I'm not familiar with those courses. I don't know, but as a suppliers, they're always offering webinars in order to introduce their products. So they have single remedies. Actually, Boron is the only one that has single remedies in Canada. So they have chemotherapy. They have all kind of natural medicines. So, but I'm not familiar with the courses that they offer. So.
Okay. Can we ask you your sources of where you get your homeopathic remedies from? Is that,
myself?
Yeah. Well, yeah. I mean, the ones that you use in your practice.
Yeah. Myself, I use Unda numbers.
Okay.
As you saw on the slides, I use Unda numbers. So Dr. Rakovac also, I mean, the homotoxicology, but the single remedies, now they're coming from Boron. Because now it's the only supplier that provides us single remedies.
Great. Okay. You got a bunch of great presentations and excellent again, as always. The usual, you're used to that, right?
Thank you so much.
So, so do you have any kind of words of wisdom for those of us that are sort of, we're out here, we kind of know a little bit about it or don't even know anything about it, where do we begin? We begin with your course. Is that where we begin?
That's true.
So,
The-
you want to put your contact in the chat room so we can contact you?
I would love to guys to work like as a team, because the reason of all these conferences, all this, we want to come together. We want to kind of integrate, and even I changed the name of the Global Scientific Guild from alternative to integrative. So this is something that we talked about it, that let's come together and just come to, kind of make a platform like for people. For example, the anti-aging, for example. Anti-aging, the name is anti-aging, quantum anti-aging, but it's anti-chronic diseases, right? We can come together and come like one unique, one platform, and then we can offer it to the world. We can offer it to everyone. So one as a homeopath, one as a medical doctor, one as a naturopath, whoever. So we come, we found a common ground. And then we work on it. If it works out, it works out. If it doesn't, then we have our separate practice. But the thing is, at least for some diseases, we can come together and offer a joint kind of workshop, which I'm doing it with other practitioners. But I would love to do it with you guys too. And if you like, we can offer joint workshop and see them. Then we see the response. And yes, I would love to, and I would love to, I would love to turn everybody to a homeopath, at least for yourself. You don't have to do it in your practice, but at least do for yourself, for your family. So this is something, it's a gift.
Do it from mom, right?
Honestly, it's a universal gift, and it's given to humanity. It's given to human beings. Let's use it. That's the reason I want everybody has knowledge on it. Before I go from this existence, I want everybody has some information and knowledge to use it for yourself, for your family, and because health starts from you. Then then your loved ones, and then in the society and the whole world, and if you don't know, you don't know, and you can help the others. That's the reason I'm here.
Okay, well, you and I will talk a little bit.
Awesome.
Not off the group, because I actually have been working on courses on what I do, which are hormone replacement and peptides, and some of them are actually ready to go. So maybe we can talk about.
Sure. That's a great one that we can work on it. So because homeopathy works amazing on hormonal pathways and hormonal conditions. It's just fascinating. So
Anybody have any other questions, comments, complaints?
No complaints.
We have with Dr. Zarrin's permission, we'll have this video up usually within 48 hours on our website, aosrd.org/webinars. There it is in the chat. We've revamped the website for the conference. I think that'll be ready tomorrow. It's it'll be a much more friendly and interactive. We hired, it got to the point where I couldn't do it all, so we actually hired an event planner, and those people know how to do that kind of stuff. So that'll be ready probably tomorrow. Dr. Zarrin, I can't thank you enough.
Thank you.
And again, anybody, Dr. Southard, if you have something to present, we're open next week. Or anybody else, anybody that wants to volunteer. Dr. Dawson, thank you for coming. Please spread the word. If you have anything that you'd like to present, we're always welcome. We always welcome.
Yeah, one thing is, yeah, I definitely have some ideas to share with you, and I'll send me your email and I'll see if the content's suitable. Okay.
Okay.
Dr.
Well,
Clearfield?
If you've been to our conference and you've heard Monica Jane, pretty much any content is suitable. She's our certified sex therapist. So, and you should see the
Okay.
comments we get from that. It's either a 15 out of a 10 or a 0 out of 10. There's no in between. So, and again, we have for our conference, we have superstars. First of all, anybody who's been paying attention knows the name Peter McCullough. He's been in front of Congress. He's been slandered by CNN. He's been, he's all over the news. If you type his name in Google, you get 36 million plus hits. He's coming, believe it or not. Jacob Teitelbaum, he's going to be online. Felice Gersh is coming. Thomas Levy is coming. And Andrew Campbell is coming. So we have really an all-star, superstar lineup. And one of my biggest challenges then was, so we have to have 30% DOs for us to be kosher with the AOA, and we were actually below that at one point, but we're good now. So so Dr. Zarrin, we would love to have you either live or online. And anybody else, we still have 1 or 2 spots left. You'll be hearing from so our event planners are Katja Lee or Jones and Tom Shalady. So if you hear from somebody, a name that you're not familiar with, that's those folks. I got to turn a lot of that stuff over to them. We'll be here next week, same time, same station. We will have another discussion. Also next week, if you're on the West Coast, Nevada Osteopathic Medical Association has their winter conference in South Lake. Go to noma.org, and it's at South Lake. It's 24 CME credits. I'm going to be doing. This is where I try out my stuff for Dr. Shake's class. So I'm going to be doing a couple of hormone lectures and maybe a demonstration on a non-surgical facelift. I haven't decided yet. We'll get a customer for that. Okay. So anybody else have any comments, questions? My email is right here, doctrbil9@gmail. Please consider coming or to the conference in Las Vegas, or at least attending online. You won't be sorry. 24 CME credits, and we get the best of the best, believe it or not. So any comments, questions? Dr. Burgess, are you there? You always
wonderful talk. Thank you again, Dr. Zarrin.
Thank you.
And this group is really coming alive. And now with this show in Vegas, things are going to change a little bit, I think. So certain subjects we've been taboo with, including homeopathy, I think we're going to start being more open, because we couldn't speak on vaccines. Then we couldn't tell the truth about weaponized viruses. My talk that my interest subject is still mind control, child trafficking, and torture. At some point, I'm hoping that our group will be able to be as honest with those subjects as they are with herbal, homeopathics, and integrative medicine. And we're getting close to the point that some things need to be said, because these issues are very important, but there's been a lot of silence on these issues, and we need to wake up. Anyway, that's my only point.
Dr. John, Dr. John, I emailed you several times. So I just want to know, did you receive my email?
No, we missed communication somehow. I also sent about 5 to you, but we'll get together.
Yes, but yeah, I sent you several emails with no response. So I
Thank
just
you.
want to let you know that I was in communication with you, but I didn't get any response from you. So
You're in
But,
trouble if he does respond.
And
I
Dr.
kind of expect him not to respond.
Dr.
That's the norm.
Also, Dr. Clearfield, I don't know how to communicate with you because the way
Tell it-
that you're responding to my communication, it's a long gap, like a week or on Telegram or WhatsApp. So what's the best way of communicating with you? Email?
Email, text message is probably too expensive for Canada, so I'll get to it eventually.
Yeah, because sometimes you don't respond for weeks, and then I say, okay, that's over. So
No, you're not getting out of it that easily.
No. I mean, for example, if I'm trying to ask you a question or
Right.
doing something together, but you don't respond, then for me it's too late to wait.
If the email is probably the best then.
Okay.
Okay.
So Dr. John, what is the best to communicate with you?
I'm email for sure, and I have no idea why not. But
Email.
within a couple of days, we'll be connected. It's very simple.
So go check your emails and see how many emails I sent you.
I wonder if they got spammed. That might have happened. Okay, I'll
Oh,
check.
maybe because it comes from my business names from Integrative
Maybe.
Medicine.
Maybe, or maybe we're being watched.
Well, we know you're being watched.
I'm being watched.
I mean, if
Okay.
I was a watcher, I'd be watching you.
Right. But thanks for everybody for doing this, and I hope this group really blossoms into something that can help.
Thank you.
Okay.
Thanks.
All right.
so
Thank you,
much
Dr.
for
Zarrin,
inviting me,
so
Dr.
much.
Clearfield. Thank you.
Everybody, thank you. Our newcomers, thank you very much.
Thank you.
And we will be in touch shortly.
Sure.
See you next week, same time, same station.
See you, everyone. Good
Okay.
night.
Good night.
Bye-bye.